One of the most common things we hear at our office is patients coming in and saying that they have a weak core and that they need to go to the gym and they need to do things like sit-ups or more loaded planks or whatever it may be. And a lot of times what we find is it's not necessarily a weak core. However, it's more so how we're utilizing our core throughout the day, when we're lifting weights, when we're picking things up, whatever it may be. So when we look at how we're utilizing our core, we like to start things with the fundamentals. We just like to work on breathing first, and then from there we then progress how we use our core into the activities that we want to do throughout the day. So when we're looking at breathing, what we start with is we have our patients lay on their back. We'll go one hand on our belly, one hand on our chest. And the idea here is we first want to learn how to breathe into the belly and expand the belly while keeping the chest as quiet as possible. So we'll take a deep breath in and breathe out. And what we're looking for, this hand should move up, right, as we fill in the lungs. Diaphragm rolls down, belly expands. As we exhale, diaphragm comes up, belly comes back down. And so this hand stays about as quiet as we can make it. And so now when we start to look at bracing or utilizing our stomach, we want to time our breath so our breath ultimately helps aid in how we're using the muscles in our core. And so when we think of our core, it's easy to think about our rectus abdominis or our six-pack muscle. But under that, we have a bunch of little muscles that wrap around the torso and act as your primary stabilizers. So when we're engaging our core, that's what we're trying to activate. And so the way we do that, if you were to pinch yourself, we grab ourselves in the back, we grab ourselves right here, right about our belly button line. We're going to take a deep breath still into that bottom hand. And then we're going to purse our lips like you're blowing into a small balloon. And I want you to push hard through the lips. And what we should feel here when we exhale, we should feel our stomach pressing into our fingertips. So if we're pinching, the muscles in our stomach should be forcing or applying pressure into our fingers, and our stomach should be getting tight all the way around. So we're not just flexing the front, we're not flattening our back, we're tensing our stomach 360 degrees around, and we're creating a strong, stable cylinder so our stomach's working as a unit. So give that a shot. See how that feels. See if you can apply that to some of the movements that are causing you pain. If you have any questions, as always, send us a message. Would love to help you out with that.